We're here to talk about Mr. Dean and what some of the results were as we completed our initial evaluations. We'll also be discussing what we plan to be working on with Mr. Dean throughout his stay here. Mr. Dean's 22 years old and arrived at the emergency department with an overdose of prescription meds, recreational drugs, and alcohol. His report indicated that he sustained 24 hours of unresponsiveness before being admitted. Because of this, he suffered some injury to his brain due to lack of oxygen, as well as deterioration of his liver functioning. He also was given a breathing tube, and after that was removed, an initial swallow evaluation showed a delay in his swallow function. However, after our evaluation, it showed that those challenges have been resolved, so that's good news. Improvements have also been demonstrated in his responsiveness, coordination, and his activity levels since he's been here. Mr. Dean's right hand, which is his dominant hand, is still not functioning at this time, and substantial weakness is a factor due to the length of time that Mr. Dean has been in bed. Mr. Dean has been displaying some poor concentration, agitation, signs of memory loss, and confusion, which is common with brain injuries. However, recent signs indicate that he has been beginning to show recovery in these areas. As we further assessed his cognitive status and we're tracking his progress in recovery, we noted that he's still in need of maximal assistance. He still gets confused and can be inappropriate at times, but it doesn't seem to be as agitated. Some agitation still persists during times when Mr. Dean is tired or frustrated or challenged cognitively. Mr. Dean will be receiving speech and language services for 60 minutes, 5 days a week, by a speech-language pathologist. The areas of focus that we will be doing with Mr. Dean will work on his long-term and short-term memory skills, with the end goal of him being able to follow directions and instructions independently. He also demonstrated difficulty with finding words, so the SLP will be giving verbal and written picture cues for words he might have trouble with at first, and then those cues will be faded so that, again, he'll be able to independently hold conversations with familiar partners about things that he is familiar with as well. And finally, we'll work to develop a daily schedule to practice planning and organizing his tasks and his daily activities so that these reminders can help him visualize what he's going to be doing for the day and hopefully result in less frustration and agitation for him throughout the week. Thank you.